So it's really looking at the interaction between the mind and the body, and the mind talking to the body, and the body talking to the mind, and their tools, their skills that are really centuries old that actually help with that conversation.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I'm doing pretty well. I've just been trying to be more mindful about everything going on. How about yourself?
Yeah, I think that's a key word. As you know me, I'm a fairly spiritual guy, and I always learned about the separation of mind and the body and how we all have our aspirations in this world and maybe in the next world or whatever you believe in. Then turns out in medicine, there's also this thing called mind-body. Who knew?
Well, are you coming back as a squirrel, Hadar?
I think I am, but I'm not sure on which tree I'm going to climb. Anyway, can we talk about some mind-body stuff and how it relates to skin and management? Because
Oh my gosh,
I think
yeah.
it's something that people really want to hear about. It's coming to our clinics every day. People want to know, hey, how can I do this or do that? And what does it even mean? So we need an expert.
Yes, we do need an expert. And actually, we are lucky because we have Dr. Kathleen Farah, and she is a holistic and integrative family physician in Western Wisconsin. She's got extensive experience in mind-body medicine. She's an associate clinical director of the Center for Mind-Body Medicine, and she is a speaker for the upcoming Integrative Dermatology Symposium in Tucson. So, Kathy, thank you so much for joining us.
Well, thank you both for having me. I'm excited to share my knowledge.
Absolutely. And I mean, you are the director of the center. So, hey, you probably know a thing or two about mind body. And so I guess maybe the first question is to ask you, what does that even mean? What is mind body medicine in the context of medicine and the practice that it is nowadays?
Yeah, and I better make it clear, I'm actually not the director, I'm an associate clinical director. So, I don't know about you folks, but when I went through medical school, I would go through maybe a dermatology rotation or a cardiology rotation or a neurology rotation. It's as if the body was split up into all these different pieces. And when I went out into practice as a family doctor, people came into me and they weren't in those various pieces. And I found that I could write prescriptions for them. I could perhaps change their medications from time to time, maybe prescribe something for their rash or for many other things that people see a primary care doctor for. But because I've been in the community so long, people would come back to me, and maybe I really wasn't doing that much good. So I really had to find a different way, or perhaps embrace other modalities to help to empower people to really do some healing for themselves. I also needed it for myself. So if I can do things like even right now, I find myself talking a little fast. If I can just pause for a moment, take a breath, I find myself calming down a bit. I can think a little clearer. So it's really looking at the interaction between the mind and the body, and the mind talking to the body, and the body talking to the mind, and their tools, their skills that are really centuries old that actually help with that conversation.
So, Kathy, let me ask you this, because I know we're going to delve into mind body, but I'm curious, what got you interested in this space, and what was the trigger for you that made you realize, hey, the mind and body are something that I really want to focus on for my career? I want to just learn more about your journey.
Yeah. So, like I said, I really found that while prescriptions are great, I still prescribe medicine, it really didn't have lasting effects. I also found myself as a practitioner of medicine where I delivered babies and went to the ER, and I was getting really stressed out. I think nowadays I might even call it burned out, for example. And I had to actually find some things for myself that would really help me so that I could really come into the office, sit with the patient, and be more present rather than thinking about my next thing on my to-do list. So that actually led me to the Center for Mind Body Medicine, which is out of Washington, D.C. And I took their training, and I've really been on this journey ever since. And I find that the tools and the skills are just so simple that sometimes people overlook them or maybe make fun of them. And I really like to share with people ways that they can help themselves.
Kathy, so much to unpack there, at least on my part. And the first thing I noticed what you were saying is that you are not doing good. You felt that your patients are not doing better, that you are not doing so well. And that ability to look inside and say, hey, honestly, look inside honestly and say, hey, something is not right. But then I think most of us have that feeling at one point in life. And the question is, what do you do? And I think that was kind of what Raja was alluding to. What have you done? And it sounds like you took a path to this training that really led you on a different path. And now you can really do better for your patients. And the reason I mentioned this is because I think on this program, we've said so many times that this is where true leaders are kind of made, right? In that moment of decision. All right, something goes wrong. What do you do? How do you take initiative? And so for those of you sitting at home thinking, wait, how do I become a leader in dermatology and integrative dermatology and anything? Is take toll of what's happening and really engage with it, lean into it to try to work the problem. So thank you for saying that, because I think it's such an inspirational statement to just off the bat, just right there. And I want to get to all these tools, but I think one important thing that you mentioned is this idea of the patients in front of us are in pieces. And I love that imagery of patient in pieces, but really when they come to clinic, they are one piece. They're one puzzle in front of us, and we're trying to kind of work with a puzzle. I know that, you mentioned all these tools and talked about breathing, for example, and I think a lot of us are familiar with various techniques, and I'm looking forward to delve into those in a second, but perhaps you can tell me, because that's a practical problem I have with myself. How do you remember to do it? So, you find yourself in a situation, and then how do you remember to say, okay, I'm going to stop and take a breath, or, whatever it is that you're going to do?
That's a great question. I think for me, the more that I can link it to something else. So, for example, for the most part, we probably don't forget to brush our teeth. So, something's as simple as taking a breath while I'm brushing my teeth, for example. I also think that there are many meditation practices that are fantastic, but they require a certain position and they require a certain amount of time. I find that if I can and invite my patients to really integrate it into their day and make it part of something they're doing already, it really becomes a usable tool. So, for example, while you're waiting for other people to, now that we're in the virtual space, waiting for other people to come on Zoom, for example, you can take a breath or two. Or the more that I listen to myself, like I mentioned earlier, I found myself talking kind of fast. And I'm like, okay, I need to slow down. And then it also can be helpful to have a dedicated time if you can. We can't always do that. But even it becomes, okay, first thing in the morning, I have a practice of journaling, and that's really helped me throughout the years. The more that it can become a practice, but it doesn't have to be a huge practice, is really how habits are built.
I love this idea, connecting it to an existing habit. And you know what I do every week? I ask people questions. So hold on, I'm going to stop now and take a breath. Fantastic. Love it. All right. Seriously, though, now, Kathy, I wanted to ask you about this other notion you mentioned, which was healing yourself. And you mentioned that as part of that process. And I love this idea because I think we often come to our patients and try to offer, basically ourselves, right? We offer all the trainings we have, our input, our opinions, and we forget that puts a toll on our ability to kind of move on and live our lives. So I'm wondering what kind of tools you use for yourself, or how did you come to the realization, and where are you in your journey now that you feel was beneficial and maybe others can learn from that in their practice?
I think the turning point for me was there was a period of my life when I was a single parent, two little kids, still trying to do full spectrum family medicine. And I sat down, I remember it like it was
Wow, that's a
yesterday.
lot. Yeah.
Yeah. And sitting across from a patient, and they were, I'm trying to say this nicer than droning on about something. And I almost said to them, "You think you've got problems, but thank
Oh
heavens
my, that's
I
awesome. I think we all had that. We all have that moment. That's so perfect. Sorry, go on, go on. Yeah.
I bit my tongue, and one of my go-to practices, by the way, is to just feel my feet on the ground. feel my feet on the ground, take a breath, and then I listened to them. And I knew I needed to do something differently. So, by the way, one of our best mind body tools is that gift of presence, of listening to someone longer than about 35 seconds or whatever it is that we generally do before we interrupt. So, that really being able to listen, that in and of itself can be very healing for them and for me.
That's interesting you mentioned that because when you study acting, this is one of the ways you connect in a scene is to connect to the presence when you find yourself kind of going in your head and wondering, oh my gosh, what does the audience think? And I think that's a tool that I learned earlier in my years on stage is doing that. So that's a fantastic idea. And I love this because we all have this moment, right? We all sit in front of patients, but it can be in front of anybody, right? In whatever job you have, but you sit in, especially in front of patients, and you try to actively listen. They teach you that, but you actively listen to the same thing over and over again. I mean, we all have kids with eczema. How many times have we heard the eczema story? How many times have we heard the psoriasis story? So I think your tip is so important to learn to connect, to be right there and then, and become a better active listener for your patients.
Yeah, no question about that. And Hadar, that's interesting that you're bringing your acting thing back into the conversation. So many aspects of life are mind body, aren't they? But to
Yeah.
really delve into the bit more around, the areas that you've been focusing on with your work, can you talk a bit more about now how do you use this in the area of pain? And pain is really the cousin of itch for us in dermatology. And so I'd really like to understand what are the tips that you're approaching, or how do you approach pain management from a mind body perspective?
Yeah, absolutely. So, one of my jobs for 17 years is I traveled from rural Wisconsin to Minneapolis, which is 50 miles away, and worked in the Integrative Medicine Clinic, which is part of the pain and palliative care clinic at Children's Minnesota. So, I worked with kids with chronic pain all the time. I'll say kids and family because it's a family thing. And so, part of the very first part is education. Is really in a kid friendly way, an adult friendly way. First of all, listening to them, validating that they're not making up this pain. And you could also extrapolate that to not making up their itch, that it's for real. Telling them about how, the pain sends a signal to the brain and the brain has to react. And pretty soon that signal becomes ingrained. And there are ways that you can actually interrupt that conversation. And they can be as simple as breathing. Oftentimes in that particular clinic, particularly with teenagers, I would use very simple biofeedback, heart math based biofeedback, so they could actually see on the screen that if they were thinking of a positive thought or even feeling compassion or something they really enjoyed, they could actually see a difference in their heart rate variability on screen. That's from the Heart Math Institute. The main thing is just to getting them to give me a moment to listen and then to try something as an experiment. I never would say for sure it works. I still don't. I just said, this is something that you can perhaps try. I do it with adults as well all the time. And it may be, oftentimes I ask them, what do they think? What helps you? And if it's something, well, a distraction, okay, then I know that I can get somewhere with some distraction. Maybe it's distraction. Somebody mentioned imagery, I think earlier. You can imagine, can you imagine what it would be like if you didn't have this itch? What would you be doing? It really instills the possibility of hope. It instills the possibility of change, which are in the midst of chronic pain, chronic itch, chronic illness. Oftentimes it's difficult to see that there's anything beyond that.
I think that's so wise because one of the things I find, and it's kind of tangential to what you were saying, is that when people come, and I see a lot of people with wounds, chronic wounds, and they would obviously complain about pain. And one of the things that I think many doctors are failing is to really ask them about the pain. I mean, some people think, well, you have a wound and it hurts. But then when you start asking them and try to localize the pain and get the history of it and how long has it been there, one of the things you're doing is making them think about it and reflect on it, which is kind of tangential to what you were saying. And that's a simple thing you can do in the clinic. I mean, it takes a little time. It takes extra 30 seconds to really get the full story. But what I find, and that's why I'm bringing it up, is that just that act of going through this actually helps them to think through this. And if they started saying, oh my gosh, I have a pain 10 out of 10 all over, then we really figure out that maybe they have a more focal pain. It's in one leg and it's maybe 10 out of 10 once a week. And it's when they change the dressings, you know? And so
Mhm.
then we kind of, okay, now I just saved you a lot of medications I may have prescribed or other things we may have done had I thought you really have all over your body 10 out of 10 pain. So I think that kind of act of reflection and using biofeedback and everything you mentioned is spot on. So thank you for sharing that.
Yeah, and I think in that situation, I think that sometimes the 10 out of 10 is just it's a cry to be believed.
So true.
I think that's really, really true because I've had a couple people that have, I mean, I can tell you just from personal experience, people go into the ER and they'll say, honestly, it's like a 3 out of 10 or a 4 out of 10, and people don't take them seriously. You know, I've actually counseled this person to go back in and say 10 out of 10. They went back in, said 10 out of 10. Immediately, we're like, okay, fine. I guess we had to take this seriously. And it was an ovarian torsion that was in the workings. And it was literally the only
Wow.
difference was the pain grading. So I think you're right, Kathy. I think you're onto a good point there. I think sometimes it is a cry for attention.
Absolutely. And I have a lecture that I give on pain. And one of my first slides is pain is objective. And it doesn't matter if the patient says they're in pain, then they are in pain. It doesn't matter what you think. It doesn't matter what they look like. It just matters what they say. And if they say they're in pain, you got to just take it at face value. And Roger, to your point, you shouldn't underestimate the number as well. So I think that's all good stuff.
Yeah, indeed.
And so maybe you can give us some specific techniques on how you would do this in clinic when patients come in and complain about more focal pain in your practice. Maybe one example of how would that look like and what kind of questions do you ask before you engage in that specific technique?
Sure. So obviously I do a full history if I haven't seen them before, what makes it better, what makes it worse, those kinds of things. I also, in that listening phase, find out what is this pain preventing them from doing, you know, and what do they want to do when the pain is gone? Sometimes I even do things like drawings. Draw yourself with your biggest problem now or with your pain now. And then another drawing, draw yourself when the pain is resolved. What will you be doing? I find out what it is that's been helpful for them. That can include medications. And I tell them, yeah, medications can be really helpful. And here's where the education piece is. Do you know that there are skills that you can do that can actually interrupt some of that pain cycle? I find out if there's things that they have done. Many people have tried things like mindfulness apps and those kinds of things. And if I get any hint from them that maybe that helped a bit, I will go down that path. But let's say I don't. Then I might say, well, would you be willing to try something that I have learned over the years? I might cite my experience in the pain clinic or cite my experience with the Center for Mind Body Medicine, in which we teach these skills in a group format, primarily for stress and trauma. And most often people will say yes. I like to tell them a little bit about what happens when your body's under stress. And by stress, that can be pain for sure. I tell them a little bit about the autonomic or automatic nervous system, how the stress response is the sympathetic. That kicks in with adrenaline, epinephrine, and norepinephrine. And then the relaxation response is really what you need to rest and digest. And they have to be in balance. And the easiest way for them to be in balance is with breathing. And so then I would invite them, and you guys can do this with me if you want. So hopefully it's okay that I called you guys.
Oh yeah, no,
No, no,
absolutely.
I'm
No,
on. I'm listening. I'm breathing. I'm
we are
with you,
guys.
Kathy.
So
Yeah.
yeah,
Alrighty.
we're on board. Let's do
Take
Okay.
us,
this.
take us there.
All right. So then just if you wish to close your eyes, you can, but you don't have to close your eyes. Many people aren't comfortable closing their eyes. I work with a lot of veterans too, by the way, with chronic pain. First of all, maybe in your hands on your belly and just breathe and don't even worry about doing it right or wrong. I do invite you to have notice your feet on the floor. And then as you're breathing, I invite you in your next breath in, whenever that feels comfortable, to feel your belly rise, your abdomen. I just call it belly for short. So abdomen rise on the inhale without forcing it, just sort of more of a noticing, and drops on the exhale. Again, inhale and exhale at a pace that's comfortable for you. It doesn't have to be the pace that I'm guiding you through. Sometimes when I notice my breathing might slow down a little bit. You can even in this moment allow your shoulders to relax, maybe even your jaw. We hold a lot of tension in our body. Continue to breathe at that pace while I'm speaking to you. Doing great. So when you breathe in this way, it actually sends messages through the vagus nerve, the vagus nerve, sends messages to the brain, says, no emergency here. It helps our body to calm. So again, continue to breathe at that pace. Thoughts will come in, by the way, totally normal, but just as easily as they come in, you can invite them out, or maybe just say, just a minute, I'm returning to my breathing. And it can even help perhaps to think of some words, perhaps breathing, just breathe in and breathe out. And that can help focus a busy mind. It can be something to come back to as you feel your abdomen rise and fall. And then maybe another breath. And if your eyes are closed, you can open them, maybe even stretch. And because this is a bit of an experiment, then we actually want to find out how was that? What did you notice? So I'm curious what you folks noticed.
Oh, this was great. Thank you. Two things I noticed. One is that you have a very unique way of doing this. I mean, obviously, I've done this many times and, had different people guide me through this. And I love the fact that you actually acknowledge the real things that happen, thoughts coming in. It's okay, keep your own rhythm. You don't have to follow my rhythm. All these things are so important, at least to me. So thank you for acknowledging that I'm not perfect and I'm not doing this perfectly. The other thing is actually this increased my pain because I was painfully thinking, oh my gosh, I should do this more often.
Right?
Absolutely.
Yeah,
Thank
the other
you.
thing I'll say is that I think it's easy to forget how many things we take for granted all around us that we should just be grateful for, even to be able to breathe and feel and to experience. And the reason I like these kind of approaches is it brings it back to just being present. And that I think is very reassuring in many ways that, there are other things that are out there that you can still key in on.
And you're so right, especially in the era of COVID. I mean, just to be able to take a breath. I mean, really. I think the other thing that it does, and in integrative medicine in general, our approach is, or at least my approach, is to not have everything be done to the patient or for the patient. This actually is more active engagement. With this particular thing, I will ask my patient or the teenager, well, first, if it's the kid, I should say, actually, first I'll ask the kid, do you want your mom or dad to remind you? And if they say no, then I'll tell the parent, this isn't up to you. I'm going to ask them to practice this. And I usually say 5 minutes, 3 times a day, which means maybe people do it once a day, but that's okay. And I think what you also said, I think to not add guilt to it. I mean, we guilt ourselves over so many things, but this is something, and I really present it, and I have to really believe it that this is an opportunity. You can try it and you get to come back and tell me how it is because I'm going to ask you if you did it, but not just to say, tell me what you noticed. And many, many times with this thing alone, and this is usually my baseline skill, people will come back and they may say, well, it's my pain's not gone. And I tell them, yeah, from the get-go, I'm not saying take 3 breaths and your pain goes away. I just want to see if there's a shift. And if it does, I think probably one of the bigger things it does, it helps to reduce some of the anxiety around pain and itch for that matter, because there's just so much anxiety regarding all of that.
Yeah, absolutely. And I think one of the things it does practically also is probably reduce the amount of medications you actually consume as a patient with chronic pain or chronic itch. It just helps so much to keep that in check because you're more connected to yourself, you're more present in your body, which I know sounds like a weird thing to say, but you're more present in your body so you can actually acknowledge when the pain exists and when it's not. And so I totally agree with that. Thank you for sharing that. Hey, Raja, I'm pretty excited to hear Kathy coming to the IDS now
Oh,
because
yes. I
now
mean,
before this I was excited, but now I really want to get kind of actual practical experience with you.
oh my
So
gosh. I mean, think about what the entire conference theme is. It's around mindfulness, Kathy. So having you come and speak is going to be like one of the key points in the symposium because this is what we want people to start having conversations around, the evidence and also the practice of mind body. So We really appreciate you imparting a bit of your knowledge here today, taking us through a guided meditation. All of you that are driving, obviously pull over, don't close your eyes. Otherwise, maybe, you can still see yourself breathe and everything, but keep your eyes on the road. But besides that, I have to say, this was a really fun one.
Thank you for joining us.
Thanks a lot.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. Use our discount code POD25 at checkout for 25% off.